Hey everyone, welcome back to Mark Education Hub. If you're preparing for the OET listening test, you're in the right place. Today we're diving into Part A, the patient consultation section. You'll learn what to expect, key strategies, and tips to ace this part with confidence, so let's get started. The OET listening subtest evaluates your ability to understand spoken English in real healthcare scenarios. Lasting about 50 minutes, it features different audio recordings including patient consultations and healthcare lectures. You'll need to grasp key details, recognize opinions, and follow medical discussions, just like in a real clinical setting. Strong listening skills are essential for effective communication in healthcare, and this test ensures you're ready for that. Stay focused, take notes, and practice actively to boost your score. The OET listening test is divided into 3 parts, each designed to assess your ability to understand real healthcare interactions. Part A focuses on patient consultations, where you'll take notes on key details from a conversation. Part B features short workplace extracts, testing your understanding of brief healthcare discussions through multiple-choice questions. Part C presents longer talks, such as medical presentations or interviews, where you'll answer multiple-choice questions based on key points and opinions. Mastering each part ensures you're ready for effective communication in healthcare settings. In Part A of the OET listening test, you'll hear 2 patient consultations, each lasting about 5 minutes. Your task is to fill in the missing words in medical notes based on key details from the conversation. This section tests your ability to capture important symptoms, diagnoses, and treatments, just like in real healthcare settings. For example, if a patient describes chest pain, you might complete notes with details like duration, pain type, and triggers. Active listening and quick note-taking are key to scoring well in this section. In OET listening, Part A, identifying key words is crucial for accurate note-taking. Focus on the who, what, when, where, and how of the conversation. Listen for details about symptoms, treatments, diagnoses, timeframes, and locations. For example, in the sentence, "I've had a sore throat for 3 days and my fever won't go down despite taking paracetamol." The key words are sore throat, 3 days, fever, and paracetamol. Training your ear to catch these details will help you complete the notes quickly and accurately. In OET listening, recognizing common medical vocabulary is essential for understanding patient consultations and healthcare discussions. Be familiar with symptoms like fever, nausea, and dizziness, as well as treatments and procedures such as prescriptions, IV drips, and surgery. Pay attention to instructions like take twice daily or follow up in a week, and know different medical roles including consultants, pharmacists, and radiologists. Expanding your vocabulary will help you grasp key details quickly and improve your overall performance. To excel in OET listening Part A, you need to listen for specific information like symptoms, treatments, and advice. Focus on key details the speaker mentions. For example, if a patient says, "I've had a persistent cough and a mild fever for 3 days," the key details are persistent cough, mild fever, 3 days. Similarly, if a doctor says take an antibiotic for a week and get plenty of rest, the important points are antibiotic course, 1 week, rest. Training yourself to catch these details will help you complete the notes accurately and efficiently. Another skill needed in OET listening. Part A is understanding. Paraphrasing and synonyms is key to accurately filling in notes. The words in the audio may not match exactly with what appears in the notes. For example, "She's experiencing hypertension" means high blood pressure, and "I feel extremely exhausted all the time" can be noted as chronic fatigue. Similarly, instructions like "take your medicine before bed" may appear as "take medication at night." Developing this skill will help you quickly recognize key details, even when phrased differently. Recognizing key details like dates, dosages, and medical conditions is another essential skill for accurate note-taking. Listen carefully for time frames. The pain started 2 weeks ago, 2 weeks. Dosage instructions, take 2 tablets every 6 hours, 2 tablets every 6 hours, and diagnoses. She was diagnosed with pneumonia after experiencing difficulty breathing. Pneumonia, difficulty breathing. Paying attention to these details ensures you capture the most important medical information efficiently. In OET listening, distractors are designed to test your ability to focus on the correct details and avoid common mistakes. One key trap is correction, where a speaker changes what they originally said. For example, if you hear, "I thought it was just a mild cold, but actually it turned out to be the flu," the initial mention of cold is misleading. The correct answer is flu. Another common distractor is synonym swaps, where different words are used instead of the exact terms from the question. For instance, if the audio says, "The patient has been feeling exhausted for days," but the question asks about fatigue or tiredness, the correct answer would be fatigue, as it matches the intended meaning. By staying attentive to corrections and recognizing synonyms, you can filter out misleading information and accurately complete your notes. Distractors like extra information and number confusion can also lead to mistakes if you're not careful. Speakers often add unnecessary details to divert your focus. For example, in "I've had back pain for about 2 months, but it's the stiffness that bothers me the most." The key detail is back pain for 2 months, not stiffness, which is a distraction. Similarly, number confusion is a common trap where multiple figures are mentioned, but only one is correct. For instance, initially, I was taking 3 tablets daily, but my doctor reduced it to 2 per day. The correct answer is 2 tablets per day, not 3. To avoid falling for these traps, always focus on the main details and listen carefully for corrections or changes. To ace OET Listening Part A, use these key strategies to stay ahead. Predict before listening by scanning the notes and guessing possible answers. Identify key words like nouns, verbs, adjectives, and numbers, while ignoring fillers like well, or you know. Stay alert for distractors such as corrections. "At first I thought it was flu, but it's pneumonia," and synonyms, exhausted = fatigue. Lastly, keep your answers short and accurate. Spelling counts, so write single words or short phrases to avoid mistakes. Master these tips, and you'll boost your listening score in no time. Ready to put your OET Listening Part A skills to the test? Practice with these helpful links to improve your note-taking, keyword recognition, and accuracy. Each video provides real exam-style listening exercises to help you get familiar with patient consultations and medical interactions. That's it for today's OET Listening Part A guide. Keep practicing, stay focused, and apply these strategies to improve your accuracy.